Thank you. Hartford HealthCare working to educate the public about the benefits of using long-action injectable medications for psychosis conditions. Doctors are using those injectables more often these days to help patients who struggle to take their medication on a regular basis. Joining us this morning, tell us more about that, Dr. Craig Allen. He is the Medical Director, Vice President of Addiction Services at Hartford HealthCare's Rushford Treatment and Recovery Program. Doctor, thank you for being with us. What inspired the move towards using these injectables to treat psychosis, and what exactly is psychosis for those out there who aren't familiar?
Yeah, psychosis is an attack on your brain where your thinking changes, your perception of reality changes. You may hear voices, or your thinking is confused, or you have ideas about people trying to get you or things. Very, very frightening, incredibly destructive. And, some people say, and I believe this to be true, that psychiatrists and behavioral health professionals should treat a psychotic episode like the medical field treats a heart attack. When you have a heart attack, your heart muscle, parts of your heart muscle are destroyed. So the effort is to stop that from ever happening again. Likewise with the brain, psychosis can be a neurodegenerative disorder. After that first episode, the effort should be to stop a second episode. And episodes reoccur when people don't take their medications. And that can happen for many, many reasons. But long-acting injectables can solve that problem and prevent that second episode, which is incredibly important.
Doctor, how does Hartford HealthCare make sure the patients and staffers are educated about these long-action injectables for this condition?
Well, in the Behavioral Health Network right now, we have a work group looking at first episode psychosis and what is the best approach for people who suffer from that and for their families and for the staff. And one of the things that we want to highlight is it's important to use these long-acting injectables as soon as possible to prevent a second episode. We want to remove some of the barriers and also some of the stigma and discrimination against using these long-acting medications.
Doctor, you brought up the issue of barriers. What are those barriers and how do you overcome them?
Well, it's hard for anyone to take their medications for any reason on a regular basis. But with this disorder, the consequences can be very severe. So the barriers could be things from forgetting to thinking that, well, I'm feeling good now, I don't need to take them. There can be insurance barriers. There could be transportation barriers. I can't get there to pick up my medication. And so we're working on strategies to address all of these issues.
All right, Dr. Allen, great information. We appreciate your time this morning.
Thank you, Keith.